Today marks National Caregivers Day. About 40 million Americans provide unpaid care to adults with disabilities or other issues in the U.S. while taking care of a loved one that comes from a place of love. Caregivers often face burnout. Dr. Brent Wallis from People's Health joins us to talk about this issue and what's involved. Dr. Wallis, good morning to you. So we're all on the same page here. How do you exactly define a caregiver?
Sure. A caregiver really can be any person, obviously, who helps to take care of someone who can't take care of themselves. And it can involve, obviously, providing care, but often they're actually a medical advocate for that individual. So they may help transport them to medical appointments and help them understand what their physician is trying to do for them. Make sure that they get their prescription medications and maybe even put them in a pill box for them. And really, in addition to that, they may help out around the house, providing cleaning and tidying up, making sure that they're in a nice, safe environment as well. So it's a really busy job.
I think your point about advocacy is important because even in a hospital setting, I saw that with my parents and I've seen that with other relatives over the course of the years. Even if you're dealing with an extremely qualified staff of nurses and doctors, you are the advocate in many cases for your family member.
Yeah, you may have to help the individual make decisions, or in certain cases, you may be the one having to make those decisions. So it can be very tough.
I know part of what you wanted to talk about was, it can be stressful. It can, even lead to burnout. If somebody's feeling like it's just too much, what advice would you have for them?
Yeah, definitely caregivers can get burnt out. They're very busy. They're caring for someone else while they're also trying to take care of themselves. And so one thing I want everybody to know is there are options. There are places you can go for help. And in particular, Respite Care is really a wonderful service. Respite is actually an opportunity to get someone in the community to come and actually give you a little bit of a break. So the care itself is for the caregiver. It's having someone else go in and actually do what you've been doing so that you can go grocery shop or maybe take care of your own family. Caregivers really can suffer from a lot of mental health disease, depression and anxiety from all the stuff that they're doing, and really stress as well.
Does health insurance help with this at times?
Yeah, they do. In fact, People's Health, my company, actually has a respite benefit. And so if we have a member that has dementia or Alzheimer's, their caregiver can actually call the insurer and request respite. And so it's really a benefit that helps the caregiver themselves.
Okay, Dr. Brent Wallis from People's Health, we appreciate the time as always. Thanks.
Thanks, John.